Good afternoon, everyone. I see our attendance is people are still signing in, so I'm going to give it just another minute or so, and then we'll get us kicked off. Thank you, Loretta. So I think we'll go ahead and get kicked off for today. So good afternoon, everyone, and welcome. My name is Brenda Groves, and I serve as the Quality Improvement Manager at KFMC Health Improvement Partners, and I'm very honored to serve as your host today. In today's session, Crossing Systems, Healthcare and Housing Working Together, Lessons from the Upside Partnership. We're grateful you've joined us for this important conversation about how cross-sector collaboration can improve health outcomes and advance health equity. Please note that today's session is being recorded and will soon be available for viewing on the KFMC Health Equity website or the Resource Hub, along with all of the handouts for today and any additional resources that may arise from today's event. Before we introduce today's speakers, we have a few housekeeping items that I would like to review. Closed captions are available for today's session, including the option for language translation. You may turn on closed captions by clicking that CC icon that is in the bottom of your Zoom toolbar. If for some reason you're not seeing that CC icon, please click the three dots with the circle around it that says more, and that should then add that closed captioning to your control panel. Once you open the closed caption menu, you can select your preferred language. If you are by chance translating from English to another language, you do need to make sure that that translation toggle switch is turned on. Handouts for today's session were emailed to all registered participants by Miss Loretta Fitzgerald. As always, thank you, Miss Loretta. If you did not receive that email, it may have been blocked by your IT system. But again, following this event, all of those materials will be sent out as well as placed on the Health Equity Resource Hub. We also invite you to locate the chat feature in your Zoom control bar, and we're going to encourage you to use that chat feature to ask any questions that you may have today. We are going to save all questions for the end of the presentation, but if something comes up in the minute and you want to make sure that we capture that, please feel free to use that chat mode to do so. So thank you again for being here, and we can go ahead and move on to our next slide. Next that we will ask, I have seen some folks go ahead and introducing themselves in chat, which is fantastic. If you have not done that, please go ahead and do so. One, that helps you get used to the chat feature, and two, it helps us to ensure we capture proper attendance. So while everyone is introducing themselves, we wanted to take an opportunity to recognize all of the amazing partners that come together to make up the Kansas Health Opportunities Coalition. So this is not just a KFMC effort. This is a collective effort of all of these amazing partners that you see on your screen here today. If you would be interested in learning more about the coalition, please reach out to me. I will put my information in chat, and I'd be happy to go over more information with you. We can go to the next slide, Loretta. So it is my distinct honor to introduce our speakers for today. I will be introducing Miss Beth Russel. Beth serves as the Social Determinants of Health Housing Program Manager at Healthy Blue Kansas. In her role, she oversees the general Medicaid housing program and is very dedicated to building strong community partnerships to ensure Kansans have access to quality housing resources and support services. So please join me in welcoming Beth. The floor is yours now, Beth.
Thank you so much, Brenda, and thank you to everyone who has just put so much together for this webinar. It's exciting for partners to come together and make sure that we have awareness of resources for housing solutions. I would like to just start off just saying that Healthy Blue Kansas has two major housing programs. The one you're going to hear about today is our housing stability program with Upside, and they're experts in how to present that. So they will be letting you know about that. I do want to let you know we also have a housing program for home modifications, and that program is available for Medicaid members that of Healthy Blue Kansas that need housing modifications and repairs. They do not have to own their home for that. The housing modification and repairs can be related to medical necessity or social determinants of health as far as stabilizing housing in place to be able to address housing insecurity and make it stronger. So, that said, today you'll be hearing about the Housing Stability Program. I'm excited for us to all get the word out for this amazing resource. And without delay, then, I will introduce you to Eliza Sydney, the Senior Director of Health Plan at Upside.
Thanks so much, Beth. It's a pleasure to be here, and we're really looking forward to highlighting the dedicated work of our teams and some of the incredible outcomes of our partnership with Healthy Blue Kansas. I'm excited to introduce you to Julie Isaacs, our Senior Vice President of Care Operations at Upside, who you'll be hearing from today as well. Julie is a distinguished leader with decades of experience in clinical mental health and operational innovation. A licensed clinical social worker and psychotherapist, Julie has held executive roles at organizations such as Heading Health, Colmac, and Kaiser Permanente, where she spearheaded transformative initiatives, including the Zero Suicide Program and advanced teletherapy standards. Julie's career is defined by a commitment to expanding access to care, improving patient outcomes, and fostering collaboration across large-scale clinical teams. Julie holds a Master of Social Work from the University of Pennsylvania and a Bachelor of Science in Family and Child Development from Virginia Tech University. She remains a dedicated advocate for both provider satisfaction and high quality delivery. Next slide, please. So Julie has a team of care guide managers you see on this slide, all who have differing skill sets, but all who are MSWs or in the process of getting their MSWs and other impressive certifications. We have a significant group of care guides who work directly with our plan partners in providing housing stabilization services to members. They are not all listed here on this slide, but just know we have a big comprehensive team of folks excited to support. And finally, also on the line, we have Megan Wagner, our VP of Operations here at Upside, who has been deeply involved with the implementation, management, and growth of our valued partnership with Healthy Blue Kansas. Next slide, please. So a little background on Upside. Upside was founded in 2020. We specialize in housing-focused care coordination, and we're able to work with members who were maybe in facilities, members already living in the community, or it may be somewhere in between. So safety, stability, accessibility, and affordability are going to be key housing challenges that we know members deal with on a regular basis that we're able to help them address. We bring expertise in housing solutions, and we know that they improve health outcomes. Stable housing isn't just important, it's essential to better health. Next slide, please. Our partnership goal is to support with safe stabilizations, and we're here to help members achieve those safe and stable housing solutions across a range of differing living situations. So some possible pathways you may see us work through is whether or not we can help someone stabilize in place. This can be eviction prevention, but also sometimes it can be helping someone get the tools and resources they need in their current living situation in order to stabilize them there. We know that stabilizations in place are going to be the least disruptive for members. So when it's safe and sustainable, we are always going to start there. We can also help transition to independent community housing, like apartments, rental units, rental houses. We can help transition to supportive housing, so whether that's folks moving in with families, caregivers, or having community supports wrapped around them. And then transition between different care settings. So for example, up into a facility, or maybe someone who is in a facility who has waiver services down back into the community. What Upside is here to do We are experienced in many different Medicaid populations. And as I mentioned earlier, we have an incredible team of care guides who are specialized. We have some that are specialized in working with LTSS settings, behavioral health, SUD. We can help families as well as individuals. Upside care guides are experts in housing focused care coordination, and care guides are a single point of contact to support the member, their care manager, and any other community partners. So, what does success look like? Success looks like us creating a housing plan with defined next steps for every referral that's sent to us and enrolled. We track measurable progress towards that stabilization during a member's engagement with us. So their needs are supported through services or care, along with minimal disruption to their quality of life through strong planning and communication. Next slide, please. So this slide is actually a direct answer to a question we received from several folks. Thank you for submitting those in advance. The question, what is the average turnaround time? When a member's care team submits a referral, we are outreaching immediately. Our average is 15 minutes, and we always outreach within 24 hours. We are successfully connecting or reaching the member within under 2 days on average, and over 67% of the time, we're able to connect with a member and reach them within the first 24 hours. From there, the timeline can depend on the member's readiness. So for members who are housing ready, in other words, they have income, documents, they're engaged, we're seeing a 93% stabilization rate, with move-ins averaging about 69 days. So that includes the full process, the discovery call and intake, the housing search, applications, landlord coordination, and move-in logistics. For members with some of the more complex barriers, like credit issues, maybe missing documents, or behavioral health needs, the timeline might extend, but our care guides will stay engaged throughout. The sooner we're involved, the more time we have to plan and the smoother the transition. And last, I'd like to mention 88% of members report improved situations after enrolling with Upside. Next slide, please. So one of my favorite parts of my job, I love getting to share our stories of impact. And I want to mention that this is a real member story here. I'd like you to meet Ron. At 76 years old, Ron had spent over 2 years in a long-term care facility following a stroke. He was having limited rehab progress, and Ron was clear about what he wanted. He wanted to get out of this facility, and he really wanted to be closer to family. But Ron faced several hurdles. He's wheelchair dependent and requires help with medication management and activities of daily living. We were able to talk with his care team, who identified that he was definitely clinically stable for discharge. Financially, Ron was on a fixed income, meaning that he didn't have the bulk of funds that's generally needed to cover the costs associated with a transition. And while his family really wanted him closer, their work schedules and home layouts unfortunately meant that living with them was not an option. So we definitely wanted to get him into a place that he could stay in and feel really good about. And that's where the Upside care team stepped in. Our care guide reached out to Ron within 20 minutes of receiving the referral. They completed a discovery call and intake call with Ron alongside his care manager to map out his care needs and the discharge timelines. From there, we held an intro call with Ron, his family, the entire care team to meet his care guide so everyone would feel good and aligned about who he's working with. We took the lead on educating the family on the ALF, the assisted living facility admission process and income limits. And most importantly, the care guide began aggressive outreach to find an in-network ALF facility that would meet Ron's specific mobility needs while staying within his budget. Our care guide contacted 6 different assisted living facilities within a 25-mile radius. We knew we needed to make sure he had a wheelchair access and stayed close to family. We were able to actually identify one that had immediate availability. It had on-site nursing and private rooms, and Ron was actually very specific about those things being important offerings in his requests. The care guide organized the tour of the facility, facilitated the application process, involved Ron's adult daughter and care manager. Ron was invited to participate in the calls with the facility intake coordinator so he could speak for himself and share some of his preferences. That allowed him to feel empowered and excited about his transition. His care guide coordinated gathering financial documents and required records. And because Ron was an active, Healthy Blue Kansas member, we were able to utilize the flex funds to bridge that financial gap. His waiver services were smoothly transitioned into his new setting by his care guide. Ron's daughter, when we spoke with her, expressed significant relief, knowing her dad would be in a safe, sustainable, engaging environment of his choosing. And today, Ron is in a community that supports his needs and keeps him close to family. So I know that was a lot of information, but it is really important to tell these stories because there's so many details and nuances in our member journeys, and each member journey can be really unique. Next slide, please. All right, I have one more member story I'll go through quickly. Healthy Blue Kansas is unique for offering housing stabilization, not just for members transitioning from a nursing facility into a home, for example, but also for housing stabilization for the general Medicaid population. So, for example, someone may be in their car transitioning to a house. I want to highlight Monica's story because it represents a specific type of crisis. Monica is a single mother working over 50 hours a week, and she was stuck in a hotel paying $70 a night because she just didn't have the bandwidth to navigate some of the complex housing systems. Our Upside Care Guide stepped in to act as a single source of support and advocacy for Monica and her family. To allow Monica to stay focused on her priorities, the Care Guide handled the housing applications, worked with crisis counselors to clear the path for some of those move-in fees. The results were incredible. In just 4 weeks, we moved Monica and her daughter into a permanent apartment. We didn't just find a home, we reduced her monthly housing costs by 40%. This gave Monica the financial breathing room she earned through her hard work and restored the stability her daughter needs to thrive. We didn't just help put a roof over their head. Our care guide actually coordinated donated furniture so it could truly feel like a home immediately. And with that, I'll pass it off to my colleague, Julie. Next slide, please. Thanks so much.
Thank you, Eliza. I'd like you all to meet Charlene. Charlene is one of our fantastic care guides that brings her clinical social work expertise combined with her hands-on housing case management experience, which is all critical for our members because they often have both clinical and social complexity. But what really makes a care guide effective is their ability to manage the full spectrum of coordination from intake alignment, documentation, to financial planning, and coordination. So while this is all done because we build trust and rapport with the members and families that we're working with. As Charlene says, her goal is simple. Take housing off the members' worry list so they can focus on their health. Next slide. So our care guides operate as, think of them as that quarterback, that tour guide who's managing the housing transition process. From the moment that we receive a referral, they're completing the discovery calls, and as you heard, typically in 1 to 2 days, and verifying readiness with the care team, and they create that individualized housing plan because everyone is unique and they have their own needs. Then the care guide handles everything from application support, housing search options, transportation, move in, what is important to those members. So is it remaining in the same school district? Is it access to their current um, spiritual house? Is it access to their medical providers, their family, friends? What is it that's going to help this become their permanent home? And so then we also ensure that we've connected them to different community supports so that they have that post-transition SDOH needs met. It's really important to emphasize that this just isn't a housing search, but it's a full transition. And because we know the workflow end to end, we reduce delays, we eliminate that fragmentation and ensure members don't fall through the gaps between that medical, behavioral, and social systems that can happen. So what we've learned is there's really four predictors of a successful transition. The first is that early referral and planning. The earlier we're engaged, the more time we have to coordinate housing, equipment, and supports before we discharge. And one of the important things to note here is that a lot of the members that we work with, we actually help stabilize in the housing where they are. So it may be eviction prevention, utility assistance. So those are things that are really key. The earlier we're involved, the quicker we can connect with the landlord and help to mitigate the situation. Second is some sort of income or benefits or the ability to apply for those. So we do assist members in getting connected with different income sources. If they need SSI, SSDI, how they get those letters, ensuring that they're connected because that stable income is essential for long-term success for rent and services. Third is that active engagement. When members participate in what's going on, we can reinforce the outcomes and improve significantly. And the fourth is that effective communication. We reach out consistently to the case managers or housing navigators or whoever is involved at the health plan, as well as any community supports, and make sure that everyone is on the same page, informed, and transitions are on track. So this is sort of that typical housing application checklist. We're validating that they have their IDs, and if not, helping them through that process of getting what they need. Same with income verification. Do they have what they need for when they're applying for housing? Financial information, those bank statements, rental assistant documents, etc. And then what is that story that exists for that member? Sometimes our members will not know how to engage in a conversation with the landlord or potential landlord. So we help coach them. We'll get on the calls with them and ensure that they're able to share the information that's needed, but not overshare to a point where now they're not selected. Um, so just side note there. And this is where the care guides really create that impact. They're collecting those records, organizing, communicating with the landlord, strengthening the application so members aren't denied simply because they just didn't understand the process. So, what are those challenging scenarios? Many of our members are not coming to us without barriers. Um, the members that we serve face many barriers that traditionally limit housing options. It could be a judicial history, credit issues, prior evictions, limited or no rental history. So rather than viewing these as disqualifiers, we view them as our navigation challenges and what can we do to help mitigate these as we're working with landlords. So we'll advocate directly. We have our own pool of landlords that we connect with, work with. And when they know that one of the people that we're referring has been working with us, they're more likely to allow some of these options for these members. Um, and then this approach allows us to successfully um, house someone who was considered too complex or too high risk for placement. And in turn, their self-esteem and other things improve. So we like to operate with a collaborative housing support. Right now, Healthy Blue Kansas really leans into the clinical side, those medical services, behavioral health, preventative care, the medical related placement, crisis placements, etc. We're not here to take those roles. We're here to be that adjunct, that support to help their members be successful. So we're providing that housing navigation, application, transition support, move-in support, coordinating those SDOH services, and working as quickly as we can to help the member have that stability that they've been yearning for. And so then it's having case conferences as needed, referral reviews. Is there ways that we can solution in SDOH, those placement closures? So, we've had, as we know, there's rural parts of Kansas. And so our, we've been successful in helping to think outside the box with those members and what is it they need and really locating services and support so that those families can move and stay in the community that they're used to being in. Thank you. So now I'm going to turn it back to Eliza.
Thanks, Julie. So one of the other common questions we received from registrants was, who pays for this? Is there a cost? So let me walk through the funding structure clearly. First, Upside services are fully funded through our partnership with Healthy Blue Kansas. There's no cost to the member for working with an Upside care guide. Second, when a member faces a one-time financial barrier to transitioning, like a security deposit or moving costs, Healthy Blue's Flex Funds program can help cover those expenses. Our care guides handle the documentation and submission, which we'll walk through in a bit more detail on the next slide. Third, ongoing housing costs like rent and utilities are the member's responsibility, but that doesn't mean that we're leaving them all on their own. Care guides work with members to identify and apply for every income and benefit program that they are eligible for so that housing stays affordable after the transition. So our goal is not just a placement, but sustainable placement. Next slide, please. Care guides are prepared to coordinate that for financial support so we can request the flex funds. To be eligible for a flex fund, the member must be an HBKS, Healthy Blue Kansas member, and they should demonstrate a barrier that is addressable with a single financial support. And other funding should always be exhausted, meaning our care guides look to community resources first and will only request flex funds once all other community or agency funding has been exhausted. So we know flex funds should always be the payer of last resort. What exactly do flex funds cover? They can cover housing transitions and stability, such as security deposits or nursing facility transitions, and cover arrears, including both rent and utilities to prevent displacement, family reunification, which covers transportation costs, provided there is confirmed housing waiting for the member at their destination. And just know that these examples are not an exhausted list. Flex funds can help with the rental arrears, as I said, but they don't cover the rental fees moving forward. So just wanted to make that note. A few program parameters around the flex funds to keep in mind. This is intended as a lifetime benefit focused on that initial setup and stabilization. While we use the funds judiciously and requests are approved on a case-by-case basis with the health plan, Upside doesn't own these funds and they can be exhausted at any time. So while we have access to the health plan funds, I want to be sure that I make clear there's no guarantee at any point that all members will be eligible for that or that all the funds will still exist. So ultimately, the health plan will determine the approval of flex funds. Next slide, please. So we have loved this chance to talk about the housing stabilization program available through Healthy Blue Kansas. I wanted to make sure to share our contact information with you all, and I really want to direct your attention to that address at the bottom. So if you have any questions at all or have any members you feel would benefit and want to submit a referral, please email housing@healthybluekansas. Next slide. So I just want to wrap this up with a really nice member quote. My Upside care manager's attention and constant communication was very relieving in a time of experiencing a crisis. Not only was she attentive, she was prompt with her response times, proving to truly be an effective and superb communicator. 10 stars for sure. Until this crisis, I had never heard of Upside. However, my care guide has made this experience of transferring into a new home with limited resources a miracle. Thank you again for having us today. We'll go ahead and open it up for questions unless Brenda or Beth, you have anything else to add before we do.
No, Eliza, thank you so very much. I don't have anything additional to ask. I do know we have a couple questions. I know Omar has his hand raised, so if you'd like to unmute and go ahead and ask your question, that would be great. And then we'll have Loretta kind of fill us in with some other questions.
Yes, this is Omar Molina. I'm a MPA looking for policies in at at the federal level. I guess is one of the things that everybody wants to know what's in the policy, what was something that CMS produce every time that they get funded housing. Is one of the priorities in rural areas. And it started last year and this year, and many even hospitals are looking for to get funded in the rural hospitals, not just in the urban areas, right? So my question is, what is the understanding of your vision and vision and bylaws about this organization that is Upside? I mean, uh, what are the people that you are looking for to provide housing, and what is other the mechanisms that you use regardless any policy in place or any funding opportunity from CMS or other I will say other foundations, I guess. I want to know the full picture of your organization. I haven't seen anything you detail in too much jargon about different process that you follow and specific examples on that case scenarios that you have already. But if you can please, but not last, get the vision and vision and the bylaws and how is something that without any grants you can get for the people that is needing that effort to get housing for them. Thank you.
So I think one of those questions, if I'm kind of summarizing that a little bit, is right now I'd like to clarify that this program is not a CMS funded program. It is through, I mean, I will let Upside kind of talk about their other streams, but the program that we are talking about today is through Healthy Blue, and it's for our Medicaid folks. So, and again, correct me if I'm misspeaking, but that would not fall under the CMS policy.
No, I was not
Okay.
asking about the program. I was asking about the upside organization.
Okay,
So
perfect.
you get it in a different way. I know that the blue program is up to the uh Medicaid or something like
Okay,
that.
perfect. I will kind of let Upside talk about maybe some of those other areas. Are there?
Yeah, I think it would be better for us to understand a little bit more exactly. It sounded like a lot of different things were being
Yeah,
asked there. So I wonder,
yeah.
is there something specific? I know you had mentioned in the chat you were curious about our vision and mission, which we're more than happy to send that off to you as well. I can actually even post it in the chat if that's something that's helpful for you. But in terms of exactly what else
You
you're
don't
looking,
you don't
Yeah,
need
and
to
me.
send any kind of information about your vision and vision. Uh, if I were you, if I were like the at least the board of the directors, I should know right away what is the vision and mission of the organization and the bylaws. It's just a brief mission and vision. You don't need to get into the details. I'm just wondering how you operate and do and get funded for the people that is needing housing, because you mentioned some examples as well. So that's my question about it, because I don't see any introduction about your organization. I guess it's like very basic information that you're supposed to be in one slide or one page of your organization. But I was like, okay, so you are blue or you are upside or something like that, or what is what? I got confused on that because you jump it right away on different things that I didn't know.
Well, I'm gonna let them answer kind of that here. I'm gonna bring in a few other questions that may, so our other attend, maybe they can answer these questions kind of as a whole and the difference between upside and healthy blue. And then Omar, if you do have more distinct questions, it may be best if we kind of answer those offline. That way you guys can maybe have that one-to-one conversation. So we can connect you there as well. We did have a specific question about landlords in rural parts of Kansas. So I'd like you maybe to talk about that. They specifically asked about Harvey, Marion, and McPherson counties. Um, and then I have a question with some mixed status families who are on these supportive programs, such as SNAP, Medicaid, and other services. Do these supportive housing funds, are they considered as public charge for the household? So I'm not quite sure how to answer those, but those are two that I have here as well. Um,
So thank you for those questions.
yes.
So in the various, we cover the entire state with Healthy Blue. So there isn't a county I don't believe that we haven't touched at this point. And Beth, you can correct me if I'm wrong on that. But what we have found and what we have, our approach has been is to really connect with landlords. A lot of them are um, not big apartment complexes, but you're talking about someone who's renting a room in their home or renting um, their next door, another property they own or what have you. So we make those connections. We're connected in Kansas with various income-based housing, with senior housing, ALFs. Um, Trailer parks. We've connected with several of those and helped them get some community resources for fixing those up and providing ramps and access when people need that. And so really, I have a wonderful team here that does a lot of the legwork in connecting and finding properties that are going to meet the needs of the families or individuals that we're working with. Um, and we follow back up to make sure it's working after they have moved in. And we run a 97% stabilization rate. 6 months after people have been housed. And so that's even after we've ended our engagement as well. We've really set them up for success. Um, to the question on how do we manage when there's other incomes in the home, we can utilize anything. If it's two roommates who want to move together, and we can work with the two roommates and collect their documents and use that to help them qualify. Same with SNAP benefits, if that's part of the household. We really look at the entire ecosystem that somebody is residing with or planning to move with. We had a situation a few months back with two sisters that were residing in a nursing facility. And one was ready to step down to an ALF level of care, and the other wasn't. But it was really important for them to stay in the same place. And we were able to move the sisters together to another facility where it had different levels of care so they could maintain that contact together and maintain um, their individual needs. Um, so we think outside the box and we do what we can, the way we would want somebody to do that for us.
Thank you,
So
Julie.
if I could speak into that just a little bit, you're hearing a customization. The customization is incredibly important. So as the care guides come in and they listen to the person, they listen to the member, they listen to the realm of influence, the network, they listen to, are there any like faith-based facilities they're connected to? So, and then they also have the community resource link from Healthy Blue Kansas. And so they're utilizing the care guide from Upside, the care coordinator from Healthy Blue Kansas, any other community-based organization that's involved can be a part of that team. So as we put that network together, then we actually, yeah, we have access, we have worked successfully with every region in Kansas, including the rural areas. So, and the frontier areas, because everybody's got some sort of network, some way, somehow. And because the care guides are taking the time to get to know the member on that level. So they aren't considering anything off limits. They're looking at what can we bring together. And they're very, very gifted at looking at those kinds of networks and bringing them together.
Thanks for that, Beth.
There is one more question from earlier in the chat. Is Social Security required?
No. We have quite a few people that are employed. Um, Maybe it's child support they're receiving, a combination of things. But if Social Security is something that they would qualify for but haven't applied or it should be reevaluated, we assist them in helping to achieve that. Same with SNAP benefits. We've helped people review that as well, but it's not a requirement. Just some sort of income. So that it becomes a sustainable housing situation. Uh, Carolyn?
Yeah, so I'm in McPherson, Kansas, and we're the only agency that helps with housing here. I get phone calls from people all the time wanting to know if we're able to help them. Sometimes we can, sometimes we can't. But if I ask them if they have Healthy Blue as their insurance, and then would it be best to have them go to that housing at healthybluekansas.com to find out how to proceed? Okay.
Yes.
Yes, ma'am,
Go ahead,
Carolyn.
Beth.
And you
Sorry.
can also, so you can do it too. You can do it with them, or you can
Okay.
give them the housing at Healthy Blue Kansas. So I'm actually the one that's going to answer that email. So when you send it, if you
Okay.
want to say, this is someone I'm working with, and you want to say like, keep me in the loop or help me know that they
Okay.
got there, we can certainly do that, and we'll get them to Upside as quick as possible.
Okay, the other thing that we are doing is, and we're not there yet, but we're going to be building five homes, 1 and 2 bedroom. We got our grant through an agency that requires us to keep them available for folks with disabilities. meaning they're all on one level. And I hear that you are saying that, you work with landlords to possibly house people. Maybe I'll reach out to you at that same email when we have those ready to house people. They're going to fill up so fast, but we want to get the right folks in there, people that need the help. So, all right, thank you.
I just have to say I love that because, as we all know, there's such a shortage of affordable housing. And so I've really loved hearing that today.
I see another question, and it may not be able to be answered today, so it may be a follow-up. But do you know if someone does not have Healthy Blue, what is that situation? Are there other resources?
Yes, I can answer that question. So, Sunflower, United Healthcare, and Healthy Blue are all three different Medicaid programs, and each MCO, which is a Medicaid program, okay, each MCO has their unique plan and their unique policy with different value-added benefits and different um, opportunities for their members. And so I can't necessarily speak into what United Healthcare and Sunflower have. They have some things. I know Healthy Blue because that's what we do. And I'm pretty sure this housing stability program we're talking about today is very unique to Healthy Blue Kansas. So I would encourage anyone you're working with that has an MCO to call the member services and say, what do you have available? Because people can have Medicaid and not even know that there are certain benefits. So I would encourage you to consider an MCO a resource.
Uh, yeah, I want to clarify something for Caroline Moore. Carrie, if you are in McPherson, you really need to contact the county that you are into. So counties have the possibility to act as your referral point. But anyways, I think what this blue, this healthy blue Kansas is at the state level, I guess. Correct me if I'm wrong, Elizabeth. But I guess is one of the efforts that you have on every single Medicaid. Mhm. And then they are gonna help you how to reach that point of contact to see if what is the entity that is gonna provide you those kind of housing, because right now even the foundations, they are moving into address that kind of housing grants to rural communities because they already developed that in their foundations with grants. So I know that like Peters, Peterson Foundation has incrementing the programs, and they are trying to reach any rural Kansas or municipality that is not in the metro area. I'm not sure if I answered your question, but we can talk more if you want to. I am the connector with Pat, Pete Patterson Foundation. If you want to try to reach me in the chat.
Sorry, Miss Lord, I was still following in chat. Did we have any new questions come in?
I think we are caught up on questions from the chat.
Does anybody else on the call have any questions that you would like to discuss? We do still have a few more minutes left in our day, or we can let you guys go. So I'll give it probably another minute to see if we have any additional questions. And again, you can type those in chat, or if you're comfortable, feel free to unmute and ask your question directly, whatever you are most comfortable with.
I do see someone asking about reaching out to speak to a community health worker group. If anyone wants to hear more about Healthy Blue Kansas or any of these housing programs, you can reach me at that housing@healthybluekansas.com email address.
Thank you so much. I'm copying your email address. Appreciate you all.
Perfect. It's great to see the connections happening in chat. So
Thank you. I will leave because I have another meeting to attend. Thank you. Bye.
Thank you. All right, everyone. Again, I just really want to thank you. I want to thank all of our speakers today for being with us. I want to thank all of our coalition partners, again, specifically today, Healthy Blue and Upside, for sharing their time, their expertise, and all of their insights with us. We're truly grateful for your commitment to advancing collaboration between healthcare and housing systems. For those of you who are on with us today, again, thank you. A brief evaluation survey will appear as you exit today's webinar. We greatly, greatly value your feedback as it helps us to improve future sessions and continue providing these meaningful learning opportunities. So please, please take a few moments to complete that survey before you log off. Another reminder, you can expect a follow-up email with information on how to access the recording, today's handouts, and your certificate of attendance. Those will come from Miss Loretta Fitzgerald from KFMC. So again, thank you to everyone for participating in today's session, Crossing Systems, Healthcare and Housing Working Together. We appreciate the work that each and every one of you do each and every day. So thank you so much.
Thanks, Brenda. Thanks, everyone.
Yes.